I'd like to answer this question on rheumatoid arthritis. I'm a GP, Dr. Merton, and rheumatoid arthritis is a long-term condition that causes pain, swelling, and stiffness of the joints. Normally affects the hands, the wrist, and the feet, but it can also affect other joints as well. Rheumatoid arthritis is an autoimmune disease whereby the immune system, which normally fights infection, attacks the cells which line the joints by mistake, and that can then cause rheumatoid type symptoms, so swollen, stiff, and painful joints. Unlike osteoarthritis, whereby there's wear and tear of the joint, rheumatoid arthritis, whereby the body attacks itself. And it can also affect other parts of the body, not just the joint as well, in later disease. Symptoms of rheumatoid arthritis include a tender, warm, and swollen joint. You also get joint stiffness that's particularly worse first thing in the morning or after periods of inactivity. You may also find that you're particularly tired or fatigued as well. So that can also be helpful in terms of the history. Early rheumatoid arthritis will affect the small joints in the hand, and that can also move on to the small joints in your feet. And it can also affect other organs such as your skin, eyes, and lungs as well. The diagnosis can be key and certainly can and often be quite difficult because inflamed joints can also mimic other conditions as well. And there's no real definitive test for this condition. With your doc or your GP, they'll certainly ask a history or find out when you're getting the symptoms and certainly ask further questions about other areas which might be impacted as well. We may want to arrange for some blood tests, so we may do some inflammatory markers such as CRP or ESR, and we may also want to do some other autoimmune antibodies such as rheumatoid factor or other factors as well, which might help in terms of diagnosis. Other investigations may include imaging, so an X-ray or scan, and that can all help in terms of build a picture of whether this is rheumatoid arthritis. And then you will be referred to a rheumatologist for confirmation of the diagnosis, but also a treatment plan. And there's plenty of medication which can be used depending on your symptoms. So I hope your appointment goes well.